Welcome to BPTV. I'm your host, Andy Amrine, and this is another Around Town. And today we're up at the office building on Fort Couch Road, right across from Eaton Park in South Hills Village, and we're introducing you to Hess Physical Therapy. These amazing therapists, doctors, have been helping out around the community a lot at a lot of the social events, and I thought what better way to introduce the rest of the community to Hess Physical Therapy. So let's go in and say hi to Matt and Jess. All right, let's start. How about introducing yourself?
My name is Jessica Homer, and I am the operations director here at Hess Physical Therapy.
Well, that's a nice title.
Yes.
Yeah, what goes with that title? Tell us what you do, because I know you have multiple locations, and Hess Physical Therapy has been in business over 15 years, and
Yes.
so tell us about it.
Well, I would say my primary role, I am a physical therapist, and that is where my
Nice.
heart will always be, is
Okay.
taking care of people. But over the years, as George has grown, it has allowed for other opportunities and for me to help with that and really make sure that the patients are continuously being taken care of and our team. So different things that we do is we try to reach out to different communities. We plan different events. I help with setting up all the physician visitations that we do, our social media. So I run and help handle all of that. And I help coverage when we are busier, just to make sure that we are providing the one-on-one care that our patients deserve. I'm there to help support our team when needed.
So how many locations?
We have 4
Okay,
locations.
what was the first?
The first
Start
one
with the oldest one.
Okay, the first one was Kennedy, and
Okay.
that is more in Robinson. I don't know if people are familiar with Kennedy,
Sure.
but Robinson. And our second one was Crafton.
Okay,
And our third one was Allison Park.
okay.
And then we just recently opened or acquired this one a
Bethel.
year ago. Yes,
Okay.
Bethel.
So what brought you to the South Hills? What brought you to Bethel Park, Upper St. Clair area? Other than we're amazing people.
Well, yes, you really are. So one thing that we have always envisioned is making sure that we can provide this one-on-one, good, close-knit type of physical therapy in all areas, and we have not been in the South Hills. The other thing is that Dr. Matt, who is at this location, is also from this area. So it has been, an honor to help him get back to his,
Back to his roots.
hometown. Yes, and support that. So that was kind of twofold with, deciding this location.
Matt, how about introducing yourself to everyone?
Yes, my name is Matt Melzak. I'm one of the physical therapists here at Hess Physical Therapy. I've been with the company for 4 years. I spent 3 years at our Kennedy Township office, and then I've been here at Bethel Park for 1 year.
Okay. What made you want to switch to Bethel Park?
So I'm originally from the South Hills. So
Nice, okay.
I was born in Carrick, but then went to Baldwin High School. So like I said, I was kind of born and raised in the South Hills. Have family and friends from Upper St. Clair, Bethel Park, Mount Lebanon. So it was kind of
feel
nice.
right at home.
I feel right at home. Yep.
Okay.
So it was nice to kind of get back to the community that I know and see some familiar faces and be able to help out.
Okay, well, give us a little bit of background. You've been with Hess Physical Therapy for 4 years.
Correct.
Was this your first company that you worked for out of school?
Yep, this was the first company that I worked for. I actually did my first rotation when I was in PT school at Hess Physical Therapy. So
Okay.
that's kind of how I got
How you got in.
my foot in the door, and it actually just worked out great with the timing that when we were opening up our third location was when I was about to graduate, and they offered me a position. And once I graduated and passed the boards, I was able to start working immediately. And like I said, I've been with Hess ever since.
Well, we're thrilled to have you in Bethel Park, and I'm anxious to learn all the different equipment and what you have to offer our residents here in Bethel Park and Upper St. Clair. It's going to be a lot of fun.
Yes.
Tell me about yourself. How long have you been with the company, though?
I've been with Hess Physical Therapy for 9 years,
Wow.
and it was my first job out of PT school.
Okay, where did
And
you go to school?
Chatham.
You went to Chatham? Okay.
Yep. So Dr. Matt also went to Chatham. But yeah, so I've been with the company for 9 years. It was my first job, and I have, grown to just invest and love in what George has to offer, what he does for his patients, and it's really none like anything other. It really isn't. It's just really good one-on-one care. It's his priority to make sure that that's happening, as well as taking care of his team, and that's why I've been here for 9 years.
Give me some ideas. What is it that you're going through school for?
Sure.
What is the training to get your doctorate and so forth on?
Absolutely.
What all are
So,
you doing?
you get your basic, your biologies, your anatomy, physiology, knowing how the body functions, how the body works. So that's kind of your prerequisites when you're at Penn State in your undergrad program. Then once you get into your doctorate program, they start to incorporate a lot more of the manual therapy skills. So the hands-on techniques that not a lot of people know physical therapists can provide. So your massages, your muscle energy techniques, your mobilizations and manipulations, you start to see how that's all integrated to provide the best care possible for the patients.
Okay, and then along with that, you're learning all this equipment we see in this room.
Absolutely.
It's not just a table you lay down on and you twist a muscle around. There's a lot more to it.
Yeah, there's a lot more. There's physics, there's biomechanics, so you have to have all those other, principles. You have to have that understanding. So another thing that is interesting to me is just having a very, very broad understanding of the medical field in and of itself, because we have to be able to screen and triage patients to make sure that they are appropriate for physical therapy. And sometimes we'll have patients come in and I'm not the person that will be able to provide them with the best care, and I have to be able to identify other problems that I might need to refer out to, a cardiovascular doctor or a neurosurgeon or an orthopedic doctor. So we kind of have to have that understanding of all those other systems, even though we have that specialization of the musculoskeletal system.
What's a normal day for you?
Absolutely. So in terms of age ranges, I've treated patients as young as 8 years old up to the mid and high 90s. So I kind of see all different age groups. And then like you mentioned, I see all different types of conditions. It could be a sports related injury like an ankle sprain or, a rotator cuff injury. But then we also see a lot of post-surgical patients. So if you have your knee replacements, your hip replacements, things along that line. But then the interesting fact is a lot of people don't know that they can come in for balance exercises. So I see a lot of older patients coming in that they might have had a fall, and then we start to identify some variables that led to that fall, and we can work on their balance. We can work on their gait training. Wow. I also have another certification to perform functional capacity evaluations. So these are evaluations that take about 3 to 4 hours for patients that might have got injured at work and they're looking to return to work, and we have to determine what their safety is to be able to do that. So that's another kind of service that we provide.
But are most of your customers referrals from doctors, or do you have customers that can just walk in off the street?
Yeah, so we have customers and patients that can walk in off the street. I've been treating for 2 years, so what that does, that qualifies me for a direct access license. So if somebody gets injured or they're having a problem, depending on their insurance, for most parts, they're able to walk in and I can perform an evaluation and then once again make sure that I'm the appropriate care provider, and then if not, then I can refer out to the other physician or PCP if needed. But yeah, patients can come walking in off the street without a prescription if they need to, or if they do have the prescription from the doctor themselves.
Okay, and patients walking in off the street, you have the support network that you're working with all the major carriers, the UPMCs and AGH? And
for the most
everybody?
part, yes, and that's part of our insurance verification process, which my receptionist, Jen, takes care of. Everybody that comes in, we make a copy of their insurance card, and then we'll call in to verify all of their benefits.
But
that way,
she will do the call-ins
oh
for
yeah,
them.
we take care of
A lot of
everything.
people just don't like making that phone call.
Yeah,
They
we try to.
Well, I'll just put it off.
Yeah.
It'll get better on its own.
Yeah, we try to make it as patient-friendly as possible and take care of as much as we can on the back end, because we know how complicated and drawn out some of these systems can be. So we try to make that experience as easy as possible for the patient.
Out of all the skills that you bring to the company, is there a part you like the best?
So I love the manual therapy certification.
Okay.
The orthopedic certification I have gives me a next level type of, separation from other clinicians. But it is my human movement specialty that is like no other.
Okay.
It is my favorite thing.
Tell me about it.
It pretty much allows for someone to analyze that we all have there's normal movement, and then things that deviate outside of that, right, can cause pain or dysfunction. So I love treating someone who just has pain. And then the idea of like, oh, you're getting older or it's arthritis. Like, I love those type of people because I know that it's more of a movement dysfunction than it is truly one of those underlying things. So once you know the movement dysfunction and you can integrate the treatment protocol for their individual needs, they get better. And it's just so fun seeing someone go and think that they have to live with pain to walking out pain free.
So my thumb hurts. There's a reason why both my thumbs
I bet
hurt.
I could fix you.
So
Okay, so
tell me what we're gonna do.
first thing is as I told Andy, I said, if anyone's giving you advice without really looking at you, you probably shouldn't take their advice. So you need both subjective information as well as a clinical exam to really give you the best understanding of what's going on.
Take advice from somebody on a phone.
No, you should come in. You really
Okay.
need to have someone look at you. And I try
Okay.
telling my family that all the time. Jesse, what do I do about that? I'm like,
do I do?
Mommy,
I
I
can't."
need to look at you. But so he was telling me
My
thumbs are
my
hurting.
thumbs hurt.
Got to get a little bit more information, which previously he was telling me. Go ahead. You can actually
Right,
tell
well,
the
the thumbs itself, when it hurts the most, is actually when I'm driving. If I'm driving any distance more than a half hour or something, it makes it really hard for me to grip the steering wheel.
Okay.
And it's both thumbs. It's not just one. It started more with the right one, but it's now slowly getting into both. Now I do try and golf. I don't golf enough anymore, but on occasion I may feel a little sting, but it's really driving or just sitting at my desk or doing something. I'll start getting a pain right at the top, not underneath, but just right on the top of both of the thumbs itself now.
And I asked, do you have any numbness, tingling that's associated with that?
A little bit on occasion on the right hand. The right hand on occasion will start tingling and go somewhat numb.
And does that correlate
I
with
just shake it
when?
off.
Yes. Does that correlate with when your thumb pain happens, or are they independent of each other?
When the thumb pain happens, as driving itself, if I don't take one hand off the wheel and shake it and grip it and move it and so forth, then I'll do it to the other one. But if otherwise the fingers and hands start going a little bit on the numb side.
Okay. Okay, so what we're going to do is, because there is that nerve involvement as well as this is like the whole human movement dysfunction, right? There are some things that are circulating through my head. I need to roll in, roll out. So I'm going to do a bunch of different movement tests with you. Can we establish right here, right now, do you have any pain?
No,
Okay. If I create any pain, let me know, okay?
I will do.
Okay.
I promise.
So I'm going to first have you square your body for me. Yep, to face. Yep, perfect. And then I'm going to have you bring your chin down to your chest. Good. Does that bring on any symptoms?
Nope.
Okay. Just going to give a little bit of a... Good. Anything there?
Nope.
Good. Look all the way up for me.
All the way up. Okay.
Any issue there?
Nope.
Just going to give you a little push. Anything there?
Nope.
Good. Can you turn your head to the right? Good. Can you turn your head to the left? Is that as far as you can go both ways? Yep.
Pretty much.
Okay. Can you go ahead and bring your ear that way? Good. And then that way. Good. Any reproduction of symptoms there?
Nope.
Okay. Can you do elbows straight for me, thumbs up, and can you raise your arms as high as you can? Good. And come back down. Can you come here? Good. Can you come all the way up? Okay. Can you come all the way down? Good. What about putting your...
Torus in the way.
Go ahead and can you put your hands behind your back for me as far as you can? Beautiful. Great job. Good. Come back down. Perfect. I'm just going to take a look at your reflexes too. Thank you. Just relax for me here. Good. And again, it's all about, relax. It's all about understanding it's not always just the thumb. So you have to make sure you roll in and roll out a bunch of different other things that could be the potential. Because, man, wouldn't it stink if you treated your thumbs for 6 weeks and then it really wasn't your thumb?
Yeah, that wouldn't be right.
Good. Good. And then relax here. Good. Okay.
See, now my staff hits me with hammers all day long.
Next thing you're going to do is you're going to pin your elbows in this way for me. Yep. Can you turn your palms all the way up? Perfect. Can you turn your palms all the way down? Beautiful. Can you make a fist like this for me? That's good. Can you bring your wrist all the way back? Beautiful. Can you bring that wrist all the way back? Good. Perfect. Can you turn it all the way up? Good. Can you bring your wrist all the way up this way? Beautiful. Come back down. Good. Turn your other arm up. Wrist all the way up. Good. Can you do this? Good. And then can you do this? Perfect. Any issues there? Perfect. Okay. Does that bother you at all?
No.
Beautiful. Good. So that there, I'm looking at the actual CMC joint. Does that bother you at all?
I feel a little pinch.
Okay. Tuck your thumb like this. Can you do this for me? Elbow straight.
Oh.
Yes. Does that bring on any of your symptoms?
No.
Even better yet. Okay. So the next thing I'm going to have you do is you're going to lay. Do you have any problems laying on your back?
No.
Good. And lay on your back for me. Good. Bend up your knees. Perfect. And are you right hand dominant?
Yes.
Okay. I am going to have you scoot down just a little bit for me. So my thought process is, one, I want to make sure it's not coming from your neck, because nerves exit your neck, and sometimes if there's stiffness or if you're holding your arms up like this, right, you might actually be pinching something up here that's causing it down here. Got to roll out your neck. You do have some stiffness in your neck, but I do not necessarily believe that it is resulting in this as of right now.
Okay.
Next thing would be, looking at the integrity of the nerves down your arm, which we looked at your range of motion. Your arm is a little bit tighter on this side. When I saw you come out, you bowed out a little bit, which tells me that when those nerves exit, right, and you're here, if you're in this position, that's relatively internal rotation, which typically correlates with radial nerve for the back of the hand getting pinched. So my question is, do you have some joint stiffness in this shoulder that's causing residual pain down here from how you're loading and holding onto your steering wheel? Okay, good, and rest here. Good. Good. Does that bother you at all?
No.
Good. Dr. Matt, do you care if you just raise up the table for me? Rest your arm for me.
I knew Matt would be handy.
He is. Good. Let your elbow fall. Good.
Is that good there?
Mm-hmm. Nice job. Does that bother you?
No.
Perfect. Good. Here. So this is what I'm talking about. So this here, we should have roughly around 70 degrees. I'm going to guess that you're at maybe 40. Can I use the other one? I like that one better. $35. Yeah, 30. And that's without a little bit. So again, so your motion loss and internal rotation here, which I'm sure if I push it, you could feel that back there. So that internal loss, think about it. That's this. When you're driving, you need to have freedom in your joint, okay? Posterior capsule's tight, radial nerve exits out that way, and I typically see radial nerve getting compressed with posterior stiffness. So, simple fix, couple shoulder mobilizations to the shoulder for releasing that, and teaching you some other different radial nerve glides could help relieve some of your thumb pain.
Perfect.
One thing that I believe all of our therapists at Hess Physical Therapy can provide to a great extent is our manual therapy skills. So
what's
we
that?
all underwent an extra certification course. So we took a year-long course that we traveled down to Maryland for, to really hone in on our evaluative skills and then our manual therapy skills. And what I mean by that, like I mentioned before, is more of the manipulation. So what people think of more chiropractic care, my back hurts, I need to go get an adjustment. So we do those type of things, and we do all kinds of massages, we do muscle energy techniques. We are advancedly trained in all of those areas. What that helps us to do is kind of accelerate the healing process in combination with the stretches and the strengthening. So like I said, all of our therapists are actually certified in orthopedic manual therapy techniques, which helps us to improve our patient outcomes even more.
So you have a lot more to offer than just a regular chiropractor who can manipulate
Correct.
the muscles, but they don't have any of the other skills, machines, and so forth.
Correct, yes.
to
It's
do
more of that
after
combined approach. Absolutely.
Well, I appreciate your time. I'm looking forward to you showing us how to use some of these
Absolutely,
machines.
yeah. Thank you very much. Yeah, so this is a leg press machine. So there's a lot of different variations of this machine in different clinics. It's a very, very popular machine, though. You'll see this in most rehab facilities. We do use this for a lot of lower extremity dysfunction. So, it could be anything from ankle pain to knee pain to hip pain, even back pain. So just general strengthening. The thing that we want to be very, very conscientious of with this piece of equipment, though, is that it is not generalized to all different types of conditions. So there are different dysfunctions that might not benefit from this. So once again, it is important to go through the evaluative process to make sure that this exercise is appropriate for you. But if it is a very, very beneficial machine that we have here that I use with a lot of my patients. So as we see here, we have Dr. Jess kind of demonstrating this for us. What this machine typically does is mimics a squat. Okay, so a squat is a very, very functional movement pattern. Almost everybody has to do this throughout their everyday life, going from sitting to standing, getting up off of the toilet or the commode, getting out of bed. So once again, we can kind of simulate and replicate that movement, and we can also vary the resistance or the weight. So there's a lot of ways that we can progress, we can regress, and we can modify. The biggest thing is we want to make sure that the patient is set up in the optimal position. Once again, we're trying to fix pain and movement dysfunction. We're not trying to add to that problem at hand. So with that, with all of my patients that come in, when I introduce them to this piece of equipment, I make sure that I provide them with assistance and setup to make sure that their foot is placed properly, their knees are placed properly, their hips are in good alignment, and once again, that way we're making sure that we're making this movement as beneficial as possible. And once Dr. Jess gets sets up here, all she's going to do is mimic a squat type of movement pattern. So she's going to let that chair come forward and then back. The biggest thing that we want to focus on here from our perspective are some more mechanical type of things. We want to make sure that her knees stay pulled apart. A lot of our knee pain, whether it's kneecap, whether it's medial knee pain, occurs from these knees collapsing in. So that's one of the common compensations that we see. So we want to make sure that those knees stay pulled apart and the weight stays back on her heels. What that's going to do, that's going to get her quads to engage, her glutes to engage, and keep pressure off of the front of the kneecap. From there, we can do, 3 sets of 8 to 12 reps, whatever is appropriate for the patient, just making sure that there's no compensations or deviations throughout.
All right, the next machine we're on, Matt, that Dr. Jess is on, it looks like it's a machine that you're just using your hands. So what does this machine do?
So this machine here, the common term for it is called an arm bike. The fancy term is called a UBE, so an upper body ergometer. This is another common piece of equipment that you'll see in a lot of physical therapy or rehab facilities. However, this is another one where we try to be specific with our setup and our posture.
Okay.
We hear it all the time, posture is everything.
Okay.
People are, working from home or sitting in the office and we're all slouched over. If we have a patient that comes in with any type of neck pain, shoulder pain, elbow pain, hand pain, and we want to get them warmed up on the arm bike here, but they have poor posture, once again, we might be making the problem worse. So one of the compensations or problems that I always see is patients are set up too far from the handles of the arm bike here, and what they end up doing is they end up leaning forward and kind of slouching over. This might cause their back to hurt. So if they're coming with shoulder pain, we put them on this, we might give them back pain, which is the opposite of what we want to do. So once again, we just want to make sure that we get our patients set up properly with good posture. The back is nice and upright, chest is upright. And then another little thing that we like to do with a lot of our patients, instead of having them push forward, it seems a little counterintuitive, but we like to have them go backwards. That just kind of reinforces that upright posture and prevents gravity from taking over and kind of leaning forward. So once again, pretty straightforward exercises, but there's some things that we can do to make it a little bit more specific and a little more beneficial.
So I think the one big takeaway is that when you go to the gym, we go to the gym to exercise the good-looking muscles, your global muscles, the ones you want to show off. But 9 out of 10 times, those muscles are not going to be the ones that help you heal or if you're in pain. Sometimes you need these muscles to be turned on prior to working your global muscles to protect you so you don't end up with an injury. And a lot of people don't know what those muscles even are. They've never heard of them, or they think they're doing them right, but they're not truly activating them. So some things that we love to work on for, if someone has back pain, they think, oh, I got to strengthen the back muscles. Well, sometimes those aren't the ones that actually need to be turned on. You need your multifidus, you need your transverse abdominis working simultaneously. I see a lot of people, oh, I got to do bird dogs. Maybe some of you have heard that, where this is a great exercise for back, right? And they're extending through here, and twisting. Completely wrong. Like, it's probably, it's not going to help you, and it might even worsen you. The idea with your transverse abdominis, they're very small little muscles. They are the muscles that stabilize. They need to be on at all times. If not, we would be limp. So you need stability muscles. So one thing to begin this is I'm actually going to put this underneath here. And I'm going to ask Dr. Matt, actually, let's put this on your back leg because they'll be able to see the rotation. So transverse abdominis and multifidus. Can you let your belly fall to the, yep, you want to make sure this is completely flat. Go ahead and pull in. Now, pull in and round your back so I can show them. That, you do not want that too much. Relax again. You'll see a lot of that deviation. You need to be able to release your stomach to the ground, pull in without moving, and that's how you activate transverse abdominis. In combination, to progress into bird dog, I'm going to step out of the camera. Multifidus is a rotational type of muscle. Can you gently, like 1 centimeter, lift that knee up? That is getting a flat back. That's the first step. Can you do this? Can you do it? Come down for me. Can you do it without shifting your weight over to lift your knee, right? Can you do it with control? So you pull in, you drive that knee up, you sustain, and then you come back down. Then the next progression is toe down. Can you lift this part of your leg? Pull in, lift up. People will want to use their hamstrings. They'll bend their knee. Not allowed. Need 90 degree. Beautiful. Come back down. People will try to bend through their hip flexor. So pull. Yes. Not allowed. So there are so many small intricate motions. Pull in, lift, then push away. Don't lift. Push away. That's what you're looking for. Then you can build the arm into it. Do you see how much different that exercise is? And he's a little weak here. Push away. That's serratus. That's even harder for him. So there's so many different progressions come down that we can do from a stability standpoint, but it's the stability muscles that heal and protect. It's not always just the global where you go to the gym and that's what you work.
Amazing. I never knew so much about it. You guys are amazing.
Oh, thanks.
Jess, Matt, I want to thank you for showing us around. Your facility is just absolutely amazing. I've learned a lot today. My thumbs are feeling better today already. But there's a lot that goes into this career, this job, this business. I've learned a lot today. But being part of Hess Physical Therapy, I mean, it has to be a rewarding career, though, for you. You are really helping people.
Mm-hmm. We are.
So it's, tell me your last thoughts and so forth about what you two do every day.
Yeah, I mean, like you said, it is a very rewarding profession, and something that I'm starting to gain an appreciation of right now is the impact that we can have in the community. Right. And, now doing different events with the community of Bethel Park, getting to meet different business owners, things like that, it really does kind of hit home and show the impact that we can have. And like I said, it could be a wide range of things, whether it's knee pain, whether it's somebody that's having difficulty walking with their balance. It truly, makes all the schooling and education and all those things that can kind of get you down, and sometimes it makes it all worth it in the end. So it is a truly rewarding job.
Yes.
Yeah, I couldn't agree more with Matt. Definitely one of the best professions. I might be biased, but the impact that you can have on people from just getting them to feel better and what you can do for people in this profession, it's outstanding. So using your skill, using your knowledge, and not getting into the routine of things, really being there for people is just what we're all about here at Hess. And I love it. I'm very, very blessed that I have had the opportunity to be in this profession and do what I am capable of doing to help people.
Well, thank you guys, and welcome to Bethel Park.
Yes, thank you.
It's going to be quite a huge asset to our community. I'm really looking forward to working with you guys and making sure that everyone in Bethel knows that you're here and you're here to help.
Thank you so much, Andy. Thank you.
Thank you for watching BPTV. I'm your host, Andy Amrine. We'll see you around town soon.